Hey guys, it's Gabe. I am officially 1 week and 1 day post-op, having had my hysterectomy. I had it via keyhole or laproscope, vaginally assisted, which means, hang on, let me show you. I had, so it went in there, there, and there, and then, you know, obviously took it all out through the vagina. Okie dokie. So pretty much I just wanted to give a basic rundown of how my surgery went. I did a lot of research into mine. I contacted every guy I could that I knew who'd had the procedure, who hadn't had the procedure, why they wanted it, why they didn't want it, beliefs, this, that and the other. As we all know, there's not enough info out there. Got some really good feedback, but I found that none of it was relevant to my experience. Pre-op I was told to prepare myself, obviously, by taking in laxatives, stool softener, just for when I was, you know, post-op. I actually started taking that pre-op just to, you know, help make sure things were cleaned out down there and avoid any unnecessary nicks or complications in surgery. And I found, you know, some guys say that they don't open their bowels for, you know, a couple of days until home from hospital. I was opening mine in hospital, so I was happy with that. It was good. We all love to poop. In regards to pain, okay, when I woke up from the anaesthetic, of course you've got it still in your system, you know, you don't really feel much. But that night, probably 12 hours post-op, I was probably an 8 out of 10 on the pain scale, mostly because of the catheter and the packing. And when I say packing, they, you know, they put gauze and bandages inside you to stop bleeding and just kind of, you know, hold everything in. So yeah, that was really uncomfortable. Imagine someone's got their fist in you. You know, it's not comfortable. So I had that and a catheter, which I'd never had, and that, you know, you can feel the urine coming out of it, and it's quite an odd feeling. Not painful, just uncomfortable. So when I say 8 out of 10, that was because when you have this surgery, they inflate your stomach with this gas, and all that gas radiates up into your shoulders, and that's what really hurt me. I had no pain in my stomach or genital area. It was just all up in the shoulders and having nausea and fevers. And I put that a lot down to my anaesthetic. I do not cope with it very well. Guys had said that post-op, you know, I'd be hemorrhaging blood. I've probably spotted blood. You know, I bought like 60 pads or sanitary napkins, as people like to call them. Yeah, I bought like a mass amount of those and haven't even gone through a packet. So I don't know if I've just been lucky, you know. What else? People told me to take in heat packs with, you know, you can either use hot water bottle or those bean bag things you chuck in the microwave. I'm sure for anyone that's having pain that would be a fantastic idea, but again for me I had no pain, so I didn't need them. I did take them, however. I took in tracksuit pants, you know, like loose elastic pants, no jeans, nothing silly like that. I took in a black towel because I was under the you know, thinking I was going to be bleeding everywhere and didn't really want the embarrassment of putting, you know, all my blood over these, you know, generic white hospital towels. So I took in a black towel, which again I didn't need. What else did I need? That was pretty much it, hey. The surgery itself, it was fine. My surgeon was Dr. Joseph Elbeaini from Sydney. He either works in Campbelltown or Liverpool. Surgery itself, as I said, phenomenal. Had a bit of an issue with the packing that he did. He forgot to leave a tag out so the nurses could, you know, easily remove it. Yeah, so they had to kind of dig around for that, which wasn't comfortable. If anyone wants to know what packing is, obviously, as I said, they, you know, this massive, you know, bandages inside you. Taking it out, I didn't find painful. I found extremely uncomfortable. I know it sounds silly, but it was like a magician pulling all those hankies out of the hat. It felt like that. It was just like the nurse just kept pulling and pulling and pulling, and out they came. And of course, you know, that's a pretty psychologically yucky thing to go through, you know. My poor nurse started crying because, you know, she felt so horrible about doing it. But, you know, we get through it. It's unavoidable in this kind of surgery. So, yeah. Minimal scarring. I was told to take 5 to 6 weeks off work. I'm already back at work. As I said, I'm 1 week, 1 day post-op. Granted, I am doing a kind of like a sit-down job, so I'm not doing any heavy lifting, anything like that. I'm listening to my body. I'm not overexerting myself. You know, it's as it is, guys. You look after yourself. You know yourself. What else? Yeah, as I said, you know, at first it was 8 out of 10, but within 24 hours post-op, I was 1 out of 10 pain scale. And I wasn't taking pain relief when I say that. I was given Panadol, Advil, whatever you like to call it, and even then I kind of just went off that. I'm on nothing now except antibiotics. My only issue with my surgeon was that he didn't really answer my questions post-op, which was really fucking disheartening. Like simple questions like, what exactly did you take out? Do I still need pap smears? What about my stitches? Can I drive? Things like that he didn't answer. And it's not like I didn't ask him, I asked him. So I found that really upsetting, and I had to, you know, pretty much beg the nurses and do a lot of Googling myself, just to do my own treatment. And I think unfortunately that's because as a nurse they think, you know, well, do your own work kind of thing, and it's like, yeah, fuck off, I'm a patient. I was told no sex 5 to 6 weeks post-op. I have broken that rule because my girlfriend's a babe and I cannot resist her. When I say sex, I'm not having penetration, I'm not stupid. So without being cheeky, like blowjobs, handjobs, and just, you know, typical bump and grind. Orgasms are perfectly fine. Lubrication, self-lubrication is totally fine, which I'm so happy about. I was really worried about that. I've got no pain with that, but I will just say that previously, before the surgery, I would experience what I would call an afterglow. So after you have your orgasm, it's kind of like this, I don't know, warm rush over you, and you can just kind of lay back and enjoy it, you know, that post-coital, as they would say. I don't get that anymore. I don't know if that's because I'm so new to my surgery post-op, or if it's going to come back gradually. It kind of feels like it's coming back because I'm still, you know, wanking and stuff. Yeah, the best way I could describe it, if you actually, like, I don't know if you watch porn, but you see, like, you know, bio or cis guys, when they ejaculate, they kind of just tend to be like, whew, okay, done, over. Like, and that's kind of how it is. There's no, like, once it's over kind of thing. But I've absolutely no complaints. I'm extremely happy with it. I would say that my chest surgery was much harder to heal from, which is funny because everyone says that, you know, this surgery is so massive, and I don't know if I've just been lucky. My nursing staff were phenomenal. I will say that moods-wise, I've been fine. Probably 4 nights post-op. I had what I would probably describe as a panic attack. I don't know if I'd call it a panic attack. It was, again, relating to my shoulder, and the shoulder felt like I needed to crack it, and I couldn't crack it, and so I was just anxious and constantly doing this and moving and couldn't sleep and got really agitated about it. So I don't know if that was just me coming off, you know, getting that anaesthetic completely out of my system as well. So, and I probably would say it was that, because I've had no issues since then. But yeah, I'm feeling fantastic. It's so much less than what I was expecting it to be in regards to pain, healing, debilitating. I'm very happy with this, very happy with my decision. Yeah, and the only other issue I had with that surgeon, he prescribed me a medication that I am extremely allergic to, and it's only because I'm a nurse that I picked it up. I'm allergic to penicillin, and he charted me amoxil, which is a generic brand of amoxicillin, which is part of the penicillin family. If I have it, I have, you know, heart flutters, coughing up blood, temperatures, vomiting, breathing problems, pretty severe. And I was quite scared that he didn't think of that, because I was wearing red wristbands, red hats, and things that, you know, like, are pretty alarming to say, hey, I've got an allergy, pay attention. Otherwise, guys, that's been it. As I said, really fantastic results for me. Any questions, please don't hesitate to ask, because I know there was lots of questions I wanted to ask. Not much information out there. And I will, you know, obviously post other videos as I go if anything changes. But as I said, healing well, feeling happy, and hope you're all good too. Alright, bye.